afternoon. My name is Chirlie. I'm going to be your nurse for today. I'm going to go ahead and wash my hands. Do you have any allergies to food, latex, or medications?
No.
Okay. Can I have your name and date of birth?
Emilio Molina, December 8, 88.
Okay. I'm going to go ahead and check the wristband, make sure it's equal. Okay. I'm going to be doing a head-to-toe assessment today, and it requires me to be exposing you and touching your body, okay? I'm going to go ahead and provide you with privacy and safety. Vital signs were done prior and they were stable. So, okay. So, how are you feeling today?
Good.
Good? And you have any pain? And before we begin the assessment, you need to use the bathroom?
No.
Okay. I'm going to put some hand sanitizer on my gloves. So, if you can please sit up for me. Okay. So, I'm going to go ahead and stand with your head. Normal cephalic head. Hair distribution is equal. No infestation. And there's no dandruff or bumps. Do you feel any pain?
No.
Okay. And can you tell me where you are right now?
At the hospital.
And what year is it?
2021.
Okay, so patients alert and oriented times 4. I'm gonna go ahead and sorry. I'm gonna go ahead and look to the patient's ears. They're symmetrical and I don't see any redness or veinage or scarring. I'm gonna look in the back. I'm gonna take my pen light. Make sure there's nothing inside. Okay, tympanic membrane is gray. Okay. Do you have any hearing aids at home?
No.
Any discomfort in your ears?
No.
Okay. And okay, so I'm gonna go ahead and check your nose. No, I'm gonna whisper a word in your ear to check the cranial nerve number 8.
Okay. Car.
Okay. So please stand up for me. Okay, so I'm gonna check the balance of the patient, make sure patient balance is stable. Okay, if you can please walk for me to the front. Walk for me. Okay, patient has no trouble to walk. Okay, sit down for me. That was cranial nerve number 8. I'm gonna go ahead and look at your face. Patient's face is symmetrical, no facial drooping. There's no scar. Everything looks symmetrical and skin color is appropriate for the patient as well. I'm gonna go ahead and look at your eyes. Pupils are equal and round. I'm gonna go ahead and put a light in your eye. Okay, pupils are reactive to light, committed to light. And I'm gonna ask you if you can please follow the tip of my pen, okay? Perfect. That was testing cranial number 3, 4, and 6. Okay, so now I'm gonna go ahead and check your nose. So expecting it's midline. I don't see any drainage. I'm gonna use the pen light and check inside of your nose. Make sure the mucosa is pink, no obstruction. You have any difficulty with breathing?
No.
Okay. Do you wear any glasses?
No.
Okay. So I'm gonna ask you now if you can occlude one of your nostrils and sniff for me. Okay, to the other side. Any difficulty?
No.
Okay, please close your eyes and I'm gonna give you something to smell. You tell me what sense you're smelling, okay? Go ahead and smell. Okay, and that's testing craving number 1. Okay, so I'm gonna check your lips. They're pink, they're not cracked. Can you open your mouth for me, please? Lips inside the patient's mouth. There's no bleeding gums, no missing teeth. The uvula is midline, and mucous membrane are good as well. Okay. Please move your tongue from side to side. Okay, perfect. And look up for me and swallow, please. Okay, that's testing cranial number 9, 10, and 12. So now I'm going to be testing your cranial 5 and 7. So move your eyebrows up. Smile. Okay. And then T and J. There's no clicking. Okay. Now I'm going to do cranial number 11. So push your shoulders up for me. Okay, now I'm going to puppy your lymph nodes. I don't see any natural lymph nodes. Let me know if you have any cholesterol with me. No pain?
No.
Okay, no tenderness and swollen lymph nodes as well. Now, let me see if there's no JD. Trachea midline. Side to side for me? Okay. No pain? Okay. Okay, no pain. Perfect. So I'm going to go ahead and auscultate your carotid artery, okay?
Right.
Okay, now I'm going to palpate it. Perfect. Okay. Now I'm gonna compare the carotid to the optical, okay? Okay, so they are equal. Okay, so next I'm gonna go to your upper extremities. Just let me look at your skin. There's no scar adhesions. Skin is appropriate for the patient. I'm gonna go ahead and check temperature. It is warm to touch. I'm gonna look at your hands. That's for capillary refills. It is less than 3 seconds. Skin trigger. Okay, there's no tenting. Okay, I'm gonna ask if you can go like this for me. Okay, there's no clubbing as well. Okay, so I'm gonna check the pulses in the upper extremities. I'm gonna check the brachial pulse and then the radial at the same time. And then I'm gonna check the range of motion strengths. Can you please just hold my hand? Hold it. At the back. And then okay, perfect. Okay, so okay, now you're gonna put your hands like this and for serial movements. Perfect. And then you're gonna go with your heels like this on the other side. Okay, perfect. So for the upper extremity, I'm gonna go ahead and yes, Okay, so I'm going to be checking your chest, okay? Okay, so I'm going to be inspecting your chest. So no distress while breathing, and it's symmetrical. There's no scars or lesion on the patient's chest. And then we look further back. There's no scar, no lesion, no surgical scars. Okay. So I'm going to do respiratory extension. So breathe through me, please. Okay. Okay, so raise and fall symmetrically. And then I'm going to go ahead and assess the sounds of the lung and the heart. Okay? I'm going to check your lungs. So just breathe in and out every time I put the stethoscope. Okay? Put in the back. Turn around. So it's 1, 1, 1, 1, 1, 1. You have a seat?
I'm sorry.
Okay, I'm gonna go ahead and check the sounds of your heart. Good morning. Herbs. And the mantra. Okay, lay down for me, please. So I'm just gonna check the stomach. Skin is fine. It's not extended. When was your last bowel movement?
An hour ago.
Was it normal?
Mm-hmm.
Okay. You have any pain? Any problems while you're urinating?
No.
Anything odor or any blood in the urine? Okay. So I'm gonna go ahead and auscultate the quadrants. So through the right lower quadrant, going up to the right upper quadrant. Go to the left upper quadrant, and then we'll go down to left lower quadrant. I'm gonna percuss. And then I'm going to let me know if you feel pain, okay? Okay, perfect. I'm gonna go ahead and go to your lower extremities. So lower extremity pulses. We start with the femoral pulse, popliteal, and then we go to the pluralis pedis and the posterior tibialis pulse, both at the same time. They were even and bilateral. I'm going to go ahead and check the hair distribution is fine. There's no edema or edema. The patient is, the temperature is warm to touch. And I'm going to do a capillary refills on the toes. And it's less than 3 seconds as well. So sit down for me, please. Okay. So I'm just going to ask you some questions. Do you have any plans to harm yourself or others?
No.
Okay. Do you feel safe at home?
Yes.
Okay, perfect. So that concludes my head to toes assessment. Do you have any questions for me?
No.
No? Okay. So go ahead and document my findings. I'm going to make sure the patient's safe. Rails up. I'm going to take out my gloves, wash my hands, and